Welcome back to Patient Win Insider. I'm Nick Moen, and I'm joined by Dr. Kuzmin, founder of Pinnacle Dental in Farmington, Connecticut. Dr. Kuzmin has scaled and sold practices before, and now he's building Pinnacle into a high-performing, patient-centered office, hitting $1.3 million in just the second year. Today, we're digging into what's working, what's broken, what it takes to grow a profitable, independent practice in today's landscape. So let's get into it. Thanks for coming on, Dr. Kuzmin.
My pleasure. Thanks for having me, Nick.
So what originally drew you into dentistry?
It's a combination of science, medicine, and art. I've always been interested in the sciences and medicine, and then dentistry is definitely, there's always more than one way to solve a problem, and the rapid advancement in technology has just it keeps me refreshed, keeps me wanting to learn, keeps me wanting to give more back to my patients. So, I like solving puzzles and problems, and people come in with problems that haven't been addressed. Sometimes they come in and symptoms have been addressed, but the problem's never addressed. So that's kind of the interesting thing about what I like doing.
Sure. Along those lines, how did you kind of learn about, problem solving? Because you started a practice in '87, is that right?
Correct. As you know, in dental school, they don't really teach you anything about business. And I thought, well, I'm a dentist, but it's a business. So you need to know how to run a business. And then you're a dentist. It just happens to be your profession. So I did a lot of reading, read a lot of books on different types of management systems, different business solutions. A big influence book in my reading is called Good to Great by Jim Collins. And there's a lot of things in there that have just resonated with my style. And, you learn that you're not a boss, you're a leader. It's different. Boss, you're sitting at a table and you're barking out orders to everybody. As a leader, you lead by example. You're out there, you make a mistake, you take ownership of it. You expect your team to take ownership of it. So just through all the years of experience, and I've worked with some practice management groups through my career, because you have to admit to yourself you don't know everything. And one of the things that was a big mantra with me is when I got out of school, I knew basics. I didn't know enough, I felt, to just go out there. So I did a residency, and then you learn it. I'll never forget the first day I'm sitting in my practice and I'm going, well, holy cow, I'm here, and if something goes wrong, it's up to me to figure it out. So you learn quickly, but that's, I think, of something that's lost on our new generation of dentists, that you have to start at the basics. If you think you know everything, then you're in a lot of trouble, especially in this day and age with all the technology. And I just think that the younger generation needs to learn how to do what I call bread and butter dentistry. Know how to do a good class 2 restoration, know how to make a nice partial, know how to make a nice denture. Nobody likes to do dentures. It's not the colorful, the classic, the things that you love to want to do, the veneers and the implants. But your bread and butter, 80% of your work is going to come, in most dental offices, is coming from restorative dentistry. So you need to hone those skills really well, and then start branching out and learning things, and become, if you're going to try something, Jim Collins calls it the hedgehog effect. You really have to go after it and really be passionate about it, and stay with it. And if you think you're just going to take a couple little courses and you're going to go out there and be taking care of people, you're going to find that it's not that easy.
Right. So a lot of learning experiences.
Yeah, lots of learning experiences, and, I like to, impart on the younger generation some of the knowledge, because I don't want them to make the mistakes that I've made. And unfortunately, some of them think they know more than the seasoned dentist sometimes. And it's hard. You have to be, as when you're learning, you have to be humble. You have to listen. You have to take in as much as you can, because from what I understand, and from when I went to dental school to when they go now, they don't get as much patient time, patient interaction time, doing a lot of things on models, doing a lot of simulation. and it's not the same thing. So, they can learn a lot from the older dentists.
And you were there in the first with your first practice coming out of residency, right? So, why did you decide to sell the first practice? But really, what made you want to do it again, to jump back in?
Well, the first practice was back in my hometown, and it was more of a personal reason. My wife was from New England, and we weren't real happy there. And so, you learn, like I said, you want to involve your wife or your significant other in where you're going to practice. And also, I was the first generation of my family to go to college, let alone be a professional. So I always thought, well, I'll come back to my hometown, and I know people and I can, help them and be busy. But didn't work out that way. So I had that practice, started it from scratch, sold it in, I guess it was like 8 years. We had no debt, and I took a loan for $69,000 to open the practice, and then sold it for 450,000. 6 years later. But it's all about systems. So anyway, so I was young. That's another reason I went to the second practice. And the second practice was in Connecticut. It's called Torrington Dental Care, and there were two doctors there, and it was mostly I would say mostly a welfare practice. But I saw the potential, the area where they were drawing, and they were smart enough to allow me to come in, and I kind of revamped the office, put in all the systems, and then that's when, after 25 years, nobody wanted to come up to Torrington, Connecticut to work. So I got frustrated with not being able to bring someone in, and sold it in 2017. And then, I had to work for 2 years. COVID hit. I tried to work for somebody else for a few years. That didn't work because I have my way. When you've been doing things as long as that, And so I bought this practice. When I bought it, it was doing 380,000 a year for the last 10 years. And so I saw the potential, the location, the town we're in, and I knew I could grow it. And so, by putting systems into place, by getting the right people in place, getting rid of insurance for the most part, and I don't mean getting rid of it, I mean not being participating, not being in network, just because the fees don't allow you to do the best dentistry. You're treatment planning according to what the insurance will let you do, instead of treatment planning for what's important to the patient. And that's always been important to me. I like to, my philosophy is you treat your patients with respect, treat them like your family, and if something you wouldn't do on your family, you're not going to do on your patient. And just kind of it just would happen the other day. I had a patient come in. He was at a different office. It was a DSO type office. He needed a lower partial, one appointment partial. He came in with it. He goes, "This doesn't work for me and I'm having trouble. Can you take a look?" Well, they made him a flipper, an acrylic flipper with wrought wire clasps on it. So, of course, it's not going to work. It's a temporary solution. But here's the kicker. When the in-network insurance companies are only allowing $1,000 for a partial, you can't do a cast partial. It's a business thing. So you're doing things that aren't good for the patient because you're a business and you have to make money. I'd much rather do it the right way. It takes 4 to 5 appointments, do it right. And the same patient, by talking and educating, we made them a regular partial, and it fits great and they're happy, and we've taken care of a problem. And that's what's happening in dentistry. People are afraid to lose patients because they're afraid of not being everybody's friend, and they think they're not going to be busy enough. And, I think we talked about this before. Busyness does not equal success. And that's where these people are running around in every insurance, working their tails off. And at the end of the day, they're like, well, I'm not getting anywhere. What's the problem? And so it's a vicious cycle. These insurance companies are charging more premiums, giving us less reimbursement, and blaming us as the problem. So we have insurance. When I bought this, she was in about 23 networks. We got rid of 20 of them right away. We're in three, now we're in two, just two. So it takes time. You can't do it all at once. You have to have a plan. If you're going to get rid of it, you have to have a plan. How are you going to keep these people in the office? Most of them are going to stay if they like you. You know, the people that are just going to you because of the insurance, you really don't, I don't know. I don't really want to treat those patients because they're not really interested in their health. They just want to know what their insurance is going to pay. And, you know, I mean, if you go to a cardiologist and you need bypass surgery and he says you need five and insurance is only going to pay for three, well, are you going to not do it? I mean, obviously that's a much bigger problem, but it's in the same vein. It's like we want to do what's best for our people. We've been trained to take good care of people. And our training, that doctor-patient relationship, is being blown apart by these insurance companies.
Sure. So insurance aside, like how would you define what the catalyst for growth were in hitting these numbers in year two of the new practice?
Well, you have to, like I said, you have to educate your patients. You have to listen to your patients. You have to understand that you need to prioritize. You may get somebody come in and they want they want to do veneers or they want to do something, but you know, you got to take their whole mouth into consideration, and they've got bombed out teeth or they've got periodontal disease. You know, you can't say, okay, let's just go do the veneer and forget about the rest. So you have to educate the patient as to why, listen, we've got to make this healthy. We got to go here. And I always say to my new patients, listen, my job is to tell you what's happening, whether it's good, whether it's bad, how we can fix it. And then we move at a pace that works for you. If we can, and we can phase certain things. And you got to gain their trust. And that's a big thing, especially when you buy a practice that's had another dentist in and you're coming in. You can't go in there all blazing guns and start saying, well, you need all of this. And they're going to say, well, Dr. Jones is, I don't need anything. Who are you to tell me? So you've got to be patient with people. You've got to let them understand you and let them know you. And you know, you need to have systems in place. Systems, how you answer the phone, how you collect money, how patients are brought back, how we talk to patients, what kind of financing. You know, you have to know the business numbers when you're doing, you know, you have to know that where your percentages are. You need to have things to educate. An intraoral camera is one of the things that have in your office. Just take a picture of something and show it to them, and you know, it's like, oh wow. So I've always found that just by treating people like a person, it's not, you know, sometimes we forget there's a person behind those teeth, and you got to get to know the person. And everybody has a different way of taking in information. Some people, and you have to be able to read that. Some people don't want to know anything. They just want to know what it's going to cost, how much it's going to hurt, and when can you do it. Then there's the person that comes in and says, I want to know everything, how you do it, you know, sometimes you just have to kind of back up a little and say, well, we can, you know, give you a good amount of information, but you have to know the kind of person they are. And then you have to kind of match the reality to the way they take information. And if you do that, and it's our job to get everything into that box where they understand the importance of it and they'll do it. And he also says there's a something called fit time. And it doesn't mean fit as in your health, it's fit into your life. Like no doesn't actually mean no. No means maybe not at this time. So if I'm presenting a case or we're doing some cosmetics and they're like, well, not right now. And I'll say, well, is it something you're interested in? Can we talk about it again? You have to ask permission. It's permission statement. Can we talk about it again? Can I bring it up again? Sometimes people say, no, I'm not interested. And like, okay, I won't bring it up again. But a lot of times people say, yeah, I'm interested. Bring it up again. And sooner or later, when the kid's done college, when they've paid the car off, when they'll come in and go, you know, I'm ready to do that. I had a patient the other day. She needed four veneers on her four anterior teeth. And when we first talked about it, it's like, well, you know, I'm not really ready. I want to do it. And she called us and said, I'm ready. I want to come in. I want to start bleaching. And she's going to do it. So you have to keep these people in your practice, keeping them engaged, get them in for their regular cleanings. You can't badger them. You can't shove treatment down their throats that they're not ready to accept. Yeah, if they've got a broken tooth or it needs endo or something, yeah, okay, that's a different story. certain things, if they're not ready to accept, you can't make them do it. And all that's going to do is push them away. You want to keep them. And the whole thing is you keep them, they get more comfortable with the office, they feel more comfortable with everybody, and then they're ready to perhaps do something.
And what's your strategy for following up with them and reminding them, say, hey, you thought about this treatment at one point, is it time yet? Do you text or email or call, or how do you reach back out to patients?
So if they say, I'm not interested at this time, but they're coming in for their regular checkups and cleanings. Well, we'll talk to them when they come in again. If it's a patient that came in for implants and they go, well, I'm going to think about it. Well, when somebody says that, then we'll reach out to them again in about a week or so. Hey, have you thought about it? What do you think? You have any questions? What's in it? What can we do for you? You always want to think, what's in it for me? It's as actually when you say, what's in it for me for them. In other words, you want to give them all the advantages, all the reasons why they should do it for their health, and let them know all of that. And then, you don't want to be a pest, because there's that fine line of reaching out with concern and being a pest, and people, that gets people turned off too. You're calling, you're trying, yourself, if say you're thinking about something and they call every week, and it's like, okay, I don't even want to deal with them anymore. So you got to walk that fine line. And my one partner used to say, it's like an annuity. You sit on it, you baby it, you take care of them, and sooner or later it comes, they'll say they're ready. And it happens a lot. It's not I've seen it over my 40 years. It happens a lot.
Yeah. Well, what about your own habits? Like, you mentioned that you operate the business as a leader, and so what sort of habits do you have in your daily practice in order to support your leadership recharge and make sure you're able to be there for your patients?
Well, we have a morning huddle every morning. We go over the schedule, check out what we're doing, where we can fit people in, where an emergency can go, questions on what we're doing, make sure we have everything we need. Let the team, they will talk about their day. The hygienist will talk about her day. She'll tell us if there's treatment that needs to be done. Then we'll say, well, talk to Mrs. Jones about it before I come in, so that she's heard it again from you, and then she hears it from me. My assistant will make sure we have everything set so that when we come in, we look professional. We know what we're doing. My front desk will be, okay, well, we've got openings, so we're going to try and get people in, call people that are maybe, the scheduling is kind of an interesting thing. Way back when I was told, worry about today and tomorrow, and everything else comes. So that's kind of my approach to that. Worry about today, worry about tomorrow, and then everything kind of fills in. People will call, things will break, things happen. So we know all that in the morning. We got all that information. Another thing is we have monthly meetings, and we'll set an agenda. We go over our goals. So in the beginning of the year, I set a goal, a per day goal that we want to hit. And then every month we base our goal on how many days we're working. And then we'll see how we're going. We have a graph in the back. I think it's important that the team share in that, so they know where they stand. If they're doing a good job, if they're not, there's bonus, and the bonus is based on how well we do. It's kind of it's a system, and it's kind of hard to explain, but if we get our goal, if we go over our goal, there's a bonus that we figure out, and everybody gets a bonus that month. We don't hit it, we don't get a goal. We don't get it. But goals aren't meant to be hit every month. It's something you're striving for. If you hit it every month, then your goal is too low, and then you got to raise your goal. The first year setting up our goals was tricky because I didn't know where we were going to go. So after the first year, we did 1 million last year. And so this year I said, okay, we'll do 3% more. But we've been more than that. So, I think after July, and I took 2 weeks off in July, and we've already done, I think, over 95,000 after even taking two weeks off. So we have those meetings. We talk about it. We don't want it to be a bitch session, excuse my French. We want it to be instructive. How are we going to do some internal marketing? How are we going to do some external marketing? what our new patients, where are we getting them from, what's working, what's not working. And then just talk about things that are, that during the day you can't really talk about, things that, that are on people's minds. Like I said, it's not a bitch session, but it's things that are on people's minds. And also to give people in the staff some control. Also, if they have a problem, there's this thing called the drama triangle. I'm sure I'm not telling you anything you don't know, but if you ever watched Everybody Loves Raymond, it's a perfect example of a drama triangle. They keep blaming everybody else and nothing gets resolved. And so what a drama triangle is I have a problem with Betty, but I go and talk to Tina instead of talking to Betty, and then Tina, so it's whisper down the alley, so nothing. So if you have a problem with Betty, you talk to Betty. You guys try and work it out. If you can't, then come to me and we'll work it out. And you just want to be, I think you want to be authentic to your team. You make mistakes too, and you want to show the team that when you make a mistake, you own up to it. We're not perfect. We try, in dental school, if you didn't do everything exactly 100% perfect, you were a failure. And that's hard to get through and by a lot of people because that's what's drilled into you. And you got to learn sometimes good enough is good enough. I mean, if you're doing a crown prep on number 2 and the person opens about this much and the cheek is flying against there and they're gagging, you're not going to do a perfect crown prep, but you're going to make sure you do it the best you can. You're going to make sure all the margins are sealed. It may not look pretty, but it's going to do what it needs to do. So you have to set your expectations accordingly. And so, I think all the team understands that I'm there for them. I'm on their side. I will take their side with patience if something happens. And I admit to my failures. If something I do fails, I don't try and cover it up. I just tell the patient, listen, this didn't work. We're going to take care of you. As soon as you say that, you diffuse the situation. We're going to take care of you. Don't worry. I'll take care of it. And you do. It doesn't happen often, but when it does, that's what you do. You don't try and. I've heard of horror stories. People have a crown, it fails in a month. They need a new crown, and the doctor's charging them again. It's like that's not how you're gonna win people over and have people stay, with you and refer people in. They're gonna say, hey, listen, Dr. Kuzmin, this didn't work, and he took care of it. And I didn't have to argue and do anything. He just said, I'm gonna take care of it, and it's done. You diffuse it, Sometimes people come in with emotional flooding, and you just need to diffuse that first. And you diffuse that, then you can talk calmly to people. I have to work on that sometimes. That's my team tells me, but it's a hard thing. It's a hard thing to do. That's kind of what you got to do.
Well, I mean, it's showing leadership by taking accountability sounds like a pretty good ethos for the practice with Pinnacle.
Yeah.
So, I mean, that, it probably feels like a success when you're making sure that you're taking care of patients, that taking accountability, the team's communicating. But what would you tell yourself in 87, starting that first practice? If you were, starting looking back, well, what anecdote would you say after all these learning experiences over the years?
First of all, I would say don't sell yourself short. Make your fees. So this is important. Make your fees fair so that you make a profit. Your patient is happy. And if there's something happens, you're not feeling bad about taking care of it. What I mean is, I first got in practice, this older lady came in and she needed 2 3-unit bridges. And I'm new in practice and I want to do these 2 3-unit bridges. And I give her the fee, and of course, at that time, it was nothing. We were charging $440 a crown, I think, a unit back then. And she goes, "Oh, doctor, can't you help me out? Can't you, da, 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 da. Can't you make it a little less?" And so I did. And I come to find out her husband he owns the regional sales of Stelladora cookies in all the Northeast Pennsylvania, and they have so you have to have worth in yourself. You can't have what Walter Haley calls approval addiction. Not everybody's going to like you. You do what's right. Educate, educate, educate. I mean, go to courses. In the beginning, I couldn't afford the courses that I've taken later in my career because they're expensive. So you take those introductory courses. You get textbooks, you read, you learn some things. most importantly, be good at that bread and butter dentistry. Watch your know your expenses, know where they should fall. Take a salary. Don't say, oh great, I had a great month. This time I'm gonna take a bunch of money, and then what if next month is not so great, and then you don't have that money. Be conservative, be proactive and not reactive. And I think that you don't need starting out. You don't need every piece of technology when you start out if you're starting from scratch. If you're buying an existing practice, look at the location, see what kind of patients they're treating, see what insurances they're in. Is the equipment old? Does the office need to be refurbished? Is it on the upswing? Is it kind of even, or is it on the downswing? So you have to take all these things into consideration and know what you're getting into. Know what you think. In my mind, I know what I can do dental wise, production wise. Know that if you have the patience, you can do that. What's my nut going to be? How am I going to take care of that? I don't want to have to worry about that. I don't want to be treatment planning because I need the money to pay the bills. You don't want to be treatment planning on being, I guess, afraid. You want to be present with the patient, giving them the best treatment that you can give. And don't be afraid to refer things out. Nothing wrong with it. You don't have to do everything. I mean, now I'm at the bladder end. I hate doing root canals. I don't do them anymore. I just don't. I'll send them out. I used to, but I hate it. Because when I first got into practice and I was working in the office in Torrington before I was a partner, I hate endo, but they needed somebody to do the endo. So I did the endo. I didn't bitch and moan and say, oh, I want to do veneers. I want to do this. It's like, okay, this is what I'm going to do. I'm going to meet people. They're going to know me. They're going to like me. People are going to come in, and then I'll start building my practice. So you have to be flexible if you're working for somebody. Do what needs to be done. Be nice to the people. Build a rapport. Educate yourself. There are many books to read on marketing. Now, like I said, Jim Collins, Good to Great. There's a book out there called Knock Your Socks Off. Service. There's a couple others out there. Paul Homily, How to Get People to Say Yes is a great book. So you have to educate yourself. I know a lot of docs in my age group don't do a lot of continuing education, and it's sad. So they're still doing dentistry the way they did it back in the 80s. That's the last thing I wanted to be doing. If I'm doing dentistry, I want to be excited about what's out there. I want to, we just brought in a 3D printer. I was mulling if I was going to buy it or not, and finally came to the point where, yeah, it makes sense. Back in the early 2000s, I had a mill in my office, and we milled our own crowns. We had an E4D, and we did the milling, and it made sense. The return on investment was there. Not so much now. I mean, you've got the dental labs that can do them well, fit well, look good for less than, you can say, well, a block is $40, but then you got to spend the time designing, have to have somebody staining them, glazing them. You have to hire it's like, look at what you're spending on that versus you got to look. That's what I'm saying. You have to be a business person. What's my return on investment? Does it make sense to put this? Is it going to make life easier for myself? Is it going to be better for the patient? These are all the questions you got to be always asking yourself. I never jump into anything, but when I do, I want to make sure I'm using it.
Yeah. I mean, thanks for your leadership and expertise in this, Dr. Kuzmin. And at some point you'll get back to consulting, right?
I'd like to. I had a company called FLK Consultants. I mean, I have a website. I still have it. And, a lot of the things we talked about today are important. There are consulting groups out there that do a lot of fluff. What I mean by fluff is, oh, if it's your patient's birthday, decorate the room and do this. And it's like, okay, so do you go to your physician or your doctor, your eye doctor, whoever, whatever, do they do silly things like that? No, it's be a professional, run your business like a business, take care of your employees, understand how business works. Just to get back to the whole insurance thing, there's a study, we talked a little Kodak study. So if you're a practice that has, and this is why you have to know your numbers, because this is how I have a PowerPoint on how to get rid of insurance, what you need to do. But I mean, if you're running at 75% overhead, you decrease your fees by 20%, Okay. Now these insurance companies are decreasing it by a hell of a lot more than 20%. You need to produce 500% more to get back to just level where you were. Okay. So imagine these insurance companies that you're taking, they're more than 20%. And then on the reverse, and the other thing is those people that are in that category, their overhead is probably higher than 75%, I would guess. The other thing, if you're 75% overhead, you raise your fees 20%. Nobody does 20% right away. But if you did, you could end up losing 45% of your patients and still make the same amount of money. And you say, oh my God, I've got all this free time. It's like, yeah, that's great. You have time to see new patients. You have time to spend with patients. You have time to build a relationship, build a rapport, get them to understand you. So that is making you more productive, more accessible, and you're giving really good dentistry to people.
I love it. Well, Dr. Kuzmin, thanks so much for sharing everything today and, coming on and, yeah, a lot of inspirational stuff. I'm excited to take another listen to it. So thanks a lot.
Sure. Thank you for having me, Nick.